everybody, my name is Pauline Valeza. I am a student nurse of Catanduanes State University. So I am going to demonstrate to you how to perform
Ballard's scale.
So basically, we have to know the fundamental things in doing such procedure. Number 1, introduce yourself. Number 2, explain the procedure and why it is necessary. So we have to explain the procedure in order to reduce the anxiety and for them to be comfortable. So number 3, observe proper hygiene. So in performing a procedure, you have to basically wash your hands, perform hand washing, or wear gloves, sterile gloves or clean gloves, wearing of PPEs, face masks, depending upon the procedure that you're going to do. Next is to ask consent. So, ma'am, sir, can I ask or can I have a permission? So you're going to ask the mom or the client, ma'am, sir, can I ask your permission in performing such procedures? And for example, the mother will say, or the patient will say, yes, okay, it's okay for me, okay. So, okay, ma'am. Next is to inquire the client's history. So, you may ask while performing the procedure, what are the history or the client's history. Another, we are going to provide privacy for the patient. So, in providing privacy, maybe the curtains, you have to close the curtains or lock the door. Next is to prepare the equipment. Observe that the equipment is within the proximity. Next is we have to position the patient.
Position the baby in a flat surface where you can examine him or her very well.
Ballard's scale is a simple examination to assess gestational age, accurate to +2 weeks.
Divided into 2 criteria, the neuromuscular maturity and the physical maturity. So the neuromuscular maturity consists of the following. So it is said to be that as gestational age progresses, the brain growth progresses and the neuromuscular progresses. So it scores from 1 to 5. So number 1 is the posture. Checks for the increasing passive flexor tone. So the lower extremities are slightly ahead of upper extremities, also called the caudocephalic. Number 2, the square window test. So it tests the wrist flexibility and or resistance to extensor stretch. So at term and post-term, the infant has maximum flexor tone and minimum flexor tone. 3, arm recoil. So this is a passive flexor tone of biceps muscles. So briefly flex the elbow, extend briefly, then release. Number 4 is the popliteal angle. So it assesses the maturation of passive flexor tone about the knee joint by testing resistance to extension of the lower extremities. Number 5 is the scarp sign. Shoulder girdle, the point on the chest to which the elbows moves easily prior to significant resistance, is noted. So the landmarks are the following. Number 6, heel to ear. Pelvic girdle by testing for passive flexion of resistance to extension of posterior hip flexor muscles. Next criteria is the physical maturity. So this includes the following, such as skin, lanugo. Number 1, skin. So in premature babies, thick, friable, and transparent. In mature, cracked, wrinkled skin. Number 2 is the lanugo. So fine hair covering the body begin to appear at 24th to 25th week and abundant at 28th week. Number 3, the plantar surfaces. So in immature or very premature, no detectable foot creases. Number 4, the breast. So fatty tissues which is dependent upon nutritional status. the eye and ears. Increasing cartilage content of ear, so in premature the pinnae remain folded when released. 6. Genitals. So in male, fetal testicles begin their descent from the peritoneal cavity. Testicles are palpable in 33 weeks of gestation. 6. Genitals for female. So in premature, the labium are flat, clitoris is very prominent and may resemble the male phallus. In mature, the clitoris and labia minora recedes and eventually developed by the enlarging labia majora. Afterwards, make sure you put the baby's clothes on and put the baby back to his or her bed. Then, perform hand washing.
So hello everyone, I am again Pauline Valeza, your student nurse. Bye-bye!